Thanks for being there. Earlier on the news, we told you that Nigeria has reported 65 confirmed cholera cases and 30 deaths across 96 local governments in 30 states from January 1 to June 11. We also told you that about 60 people have been hospitalized in Lagos with about 4 deaths recorded. We have joining us on the news to discuss this Dr. Chukwuka Paschal Obodo, CEO and co-founder MyMedicare. Dr. Obodo, finally, we're able to have you join us on the news. Thank you.
Thank you very much.
So we're actually looking at the numbers, 65 confirmed cases of cholera outbreak in the country between January 1 and June 11, with about almost half of that people died. 30 people actually died. Now, I was actually asking in terms of the reactionary time to these cases and the kind of treatment being preferred, would you say that the services or the service has been optimal, or do you think more could have been done to save those lives?
Okay, thank you very much for that. All right, so for me, obviously the numbers are very, very hard. Okay, quite a number of individuals. When we're talking about human beings, okay, that died because probably they didn't get what they needed to, the treatment that they needed to get. All right, and proper follow-up. Okay, so it's not a figure that we need to be proud of, and I really believe that a lot can be done to keep that moving forward.
So what measures now can individuals and communities take to prevent the spread of cholera, especially during this rainy season?
Okay, so I'll have to break it down to individuals, communities, and of course environmental. Okay, for individuals, okay, personal hygiene is very important. Washing of hands, cleaning your toilets. Okay, ensuring that the water you take, if you're not sure the source, you can boil the water for decades. Okay. For the community, at the community level, health education, because many people don't even know how cholera is transmitted. Okay, so a lot can be done about that, just like we are doing now, telling people more about cholera, teaching them to understand, how it's being transmitted. In addition to that, safe treatment of water, okay, making sure that water is properly treated at the plant before being disposed to individuals that will consume that. And at the environmental level, ensuring that we don't throw in dirt, okay, or waste products into our waters or gutter, because at the end of the day, it might still find its way into the water supply that most individuals have access to.
All right, now we know that Lagos has a population of about 20 million. Now, given the recent outbreak in the state, what steps would you expect health authorities to take in order to manage and contain the spread of the disease, most especially in a country that is heavily trafficked by people?
Okay, so about that, number one on the list is still people. Okay, vaccination campaigns can also be done because there's a vaccine that can be given to more or less enhance people's immunity to cholera. In addition to that, having protocol team, okay, I think that should be the best thing to be done. Okay, this protocol team, what they will have to do is identify those that have cholera, isolate them, properly treat them. Okay, treatment this time has to do with rehydration, giving of antibiotics, to those individuals that are already affected. More so, I also talked about the vaccine. Very, very important that they do that because that can help, curtail that. And I believe in that a lot of lives can be saved.
Let's speak more about what an individual can do, most especially in suspecting such a case. If I am to actually find out or notice that someone has the strains or symptoms rather of cholera, what are the physical signs that I should be looking out for?
Okay, what is true? Okay, this individual, those that have cholera, they find it very hard to control their stool. Okay, their passwords to stool from continuously. In addition to that, some individuals vomit. Okay, when it gets very bad, because certain electrolytes are being lost, there could be cramps. Okay, muscle cramps, other form of objections. So these are the signs. Okay, that these individuals have. So moving to that, when you have, when you're feeling very badly, and dressing a lot, ensure that you hydrate yourself properly and report to the nearest hospital. so I can receive appropriate treatment.
All right, Dr. Chukwuka Paschal Obodo, CEO and co-founder MyMedicare. Thank you so much for educating us this afternoon.
All right, bye.